Hello everyone. In this video, we are going to discuss a very important topic, that is antiretroviral drugs. So let me share my screen quickly with you. I guess you can see my screen and let's start it. So as I told you, in this batch, the Prof Buster Live Progenitor batch, the highlight of this batch is integration, and we have already covered HIV, virus and microbiology in detail. I guess you must have watched my video on HIV. I taught you HIV in bloodstream and serious infections in much detail. I guess you know everything about the HIV. Here I am today to teach you the treatment of HIV, and that is known as antiretroviral drugs. So today's topic is antiviral drugs. In the antiviral drugs, I already taught you non-retroviral drugs, and in this video it's a pharmacology session in which I am going to teach you antiretroviral drugs. So let's start it. So here it's a portion of antimicrobial drugs. We know in antimicrobial drugs we have all these chapters to be covered, and all of them are covered except the antiviral drugs. In the antiviral, we divide the antiviral into two portions, non-retroviral drugs and retroviral drugs. So here in this video, I'm covering anti-retroviral drugs. The non-retroviral drugs already covered in a separate episode. You can watch that also. So here in this video, I am covering antiviral drugs, that is anti-retroviral drugs. That is treatment of HIV/AIDS. So here it's a very important topic. Very frequently you get questions, MCQ questions in your competitive exam, as well as long question or short questions in your university exam. So it's an ultra important topic. Make a 5-star over it. Okay, so let's start it. Let's start the antiretroviral drugs. You can't understand it unless and until you revise HIV virus. So first of all, we have seen the morphology, the ways of transmission of HIV virus. Although we have already seen that in the microbiology, here quickly we will revise it and we will move on the drugs. So in the first 5, 10, 15 minutes, we will revise the microbiology of the HIV virus. Okay, its life cycle specially, because if you understand the life cycle, you will understand the mechanism of action of these drugs, which will interrupt the various steps of the life cycle. So before I start the drugs, if you want to understand the mechanism of action of these drugs, antiretroviral drugs, you have to understand the life cycle of the HIV virus, because these drugs will interrupt the various steps of the life cycle only. So let's start the morphology of HIV virus. So let's revise microbiology first. Okay, so in the morphology of the HIV virus, I will be discussing three things: its envelope, its nucleocapsid, and its genes. Okay, so let's start with envelope. The envelope of the HIV virus. Can you see the diagram of the HIV virus? In this diagram of HIV virus, you can see it's an enveloped virus. It's the RNA virus. Okay, it is having a single-stranded RNA and it is an enveloped virus. On the envelope, two glycoproteins are present, glycoprotein 120 and glycoprotein 41. Glycoprotein 120 is responsible for attachment and 141 is responsible for fusion. What is attachment? What is fusion? I will let you know. So this one is responsible for attachment with the host cell. This one is responsible for fusion of the host cell. The host cell is CD4 lymphocyte of the human. Okay, there are two glycoprotein. You can see in the diagram. In the diagram, appreciate the envelope. This is the envelope. I guess you all can see this is the envelope. On the envelope, appreciate glycoprotein 120 and glycoprotein 41. This mushroom shape is glycoprotein 120. You can see this is glycoprotein 120. This mushroom shape is glycoprotein 120. And you can see this straight line. This is glycoprotein 41. So glycoprotein 41. So glycoprotein 120 and glycoprotein 41 both are present on envelope. So we are done with envelope. On the envelope, two glycoproteins are there. Glycoprotein 120, which is mushroom shape, and glycoprotein 41. These two glycoproteins are present on the envelope. Let me come on the nucleocapsid. You can see the interior, the nucleocapsid. In the nucleocapsid, two copies of single-stranded RNA is present. Can you appreciate the two copies? The two copies of single-stranded RNA, the two identical copies of single-stranded RNA is present, over which three enzymes are present. You can see reverse transcriptase, integrase, and protease. So here reverse transcriptase, integrase, and protease are present. So two copies of RNA along with three enzymes. Learn two copies of RNA with the three enzymes. That is the interior. That is nucleocapsid. And now coming on the genes. There are total 9 genes present in HIV virus. 3 of them are structural and 6 of them are non-structural. The 3 structural genes, I guess everyone know the 3 structural genes of the HIV virus. You may have read this in microbiology in much detail. GAG, POL, and IN. In microbiology, I taught you what does GAG synthesize, what does POL synthesize, what does IN synthesize. You may be knowing that. And the 6 non-structural genes, they are in front of you. You can read the names. So total 9 genes are there. So this is the morphology of HIV virus. I guess everyone have understood what is the morphology. In the morphology, there is an envelope On the envelope, 2 glycoproteins are there. You can appreciate the 2 glycoproteins, glycoprotein 120. This is glycoprotein 120 and this is glycoprotein 41. This is glycoprotein 41. Okay, glycoprotein 120 and 41 both are present. Okay, on the envelope. You can see the interior, that is nucleocapsid. This one is nucleocapsid. Inside the nucleocapsid, 2 copies of single-stranded RNA is present. You can appreciate. And on the 2 copies of single-stranded RNA, 3 enzymes are present: reverse transcriptase, integrase, and protease. These are the 3 enzymes. I will let you know the function of these 3 enzymes. Now coming on the modes of transmission, you tell me, how does HIV transmit? HIV transmit from one individual to another. There are 4 ways. What are the 4 ways? They are in front of you. Most common way of transmitting the HIV is sexual intercourse. Okay, one person is positive, another person is negative. If these 2 persons, whether the male or female, they are having sexual intercourse with each other, it can transmit, or it can be transmitted between homosexuals also. Okay, so the sexual intercourse is the most common way. Out of total percentage of transmission, 75% transmission is due to sexual intercourse. 75% transmission is due to sexual intercourse. Second most common way is percutaneous and vertical. 10%. Okay, this is percutaneous, needle prick, injury. Okay, from a positive patient. Okay, the same needle prick injury, or you can say the instrument injury. So that is percutaneous. That accounts for 10% of the transmission. And this is vertical. Vertical is from positive mother to the fetus via placenta. Okay, transplacental, vertical. It also transmit 10% of the total HIV transmission. So 75 plus 10 plus 10. 75, 85, 95. 95%. The least common route that accounts for 5% of the transmission is blood transfusion. Okay, because blood transfusion, it's very rare with blood transfusion. Because blood transfusion is not direct in India. In India, there is a donor. Donor cannot give blood directly to the recipient. No, it is via blood bank. So there is a blood bank. So donor donates the blood to the blood bank. The blood bank will screen it. Okay, and via blood bank, if it is negative, it is handed over to the recipient. If it is positive, it is discarded. Okay, so via blood transfusion, it's very rare. If the blood bank is doing some mistake, in that case it's possible. Or else, if illegally some positive donor is giving blood to the recipient directly, illegally, without a blood bank. That is how it is possible. Otherwise, with blood transfusion, it's rare. So these are the 4 ways, and you can appreciate the percentage. Okay, so most common is sexual intercourse, least common is blood transfusion. Total 4 ways of transmission is there. Now, coming on the life cycle, the ultra important, the life cycle of the HIV virus. It's very important to understand the life cycle before I start the drugs, because the mechanism of action of all drugs depends on the life cycle. They will inhibit the various steps of the life cycle. You have to understand the life cycle in detail. Okay, now you can understand the host cell is human CD4 lymphocyte. Human CD4 lymphocyte or macrophage. Okay, the target cell, HIV. So whenever HIV enters in a human being, in the blood of a human being, it hits either CD4 lymphocyte of that human or macrophage of that human. So the target cell is CD4 lymphocyte or macrophage. Okay, now 2 things are required. One is main receptor, which are required for entry, and one is co-receptor required for fusion. First attachment. Entry means attachment. You can write down its attachment. Okay, attachment. So main receptor required for attachment and co-receptor required for fusion. I will let you know what is main receptor, what is co-receptor. Can you see this diagram? In this diagram, can you realize what is the host cell? Where is the host cell? You all can see where is the host cell. This is the host cell. Let me draw the host cell for you. You can appreciate this is host cell. Okay, appreciate the host cell. And you can see this is the virus. This is the HIV virus. How does HIV virus attach and fuse with the host cell? For attachment, okay, this is HIV virus, appreciate it. And this is host cell. Host cell, what is host cell? Host cell is CD4 lymphocyte or macrophage of the human. The host cell is either CD4 lymphocyte of the human or macrophage of the human. You can see this is host cell and this is virus. So whenever the HIV virus enter in the blood of a human, the target cell is CD4 lymphocyte or macrophage of the human. Now first attachment takes place and then fusion takes place. How does attachment takes place? For attachment, we require main receptor. So the glycoprotein 120 of the virus bind with CD4 receptor of the host cell. This is known as main receptor and it is required for attachment. The main receptor is required for attachment. This is how the virus attach with the host cell. This is required for attachment. Okay, glycoprotein 120 bind with CD4 of the host cell. What of virus, what of host cell? They are binding with each other. So virus ka glycoprotein 120, it is binding with CD4 receptor of the host cell. This is attachment. This is main receptor. But this is just attachment. It is not fusion. Now after attachment, we need fusion. For fusion, we need co-receptors. What are co-receptors? So on the virus, we have GP41. The GP41 of the virus bind with either CXCR4 or CCR5. The host cell have one of the receptor. Some host cell have CXCR4. Some host cell have CCR5. So there is combination of GP41 either with CXCR4 or CCR5. Depending, there is T tropism or M tropism, like that. Okay, I mean the T lymphocytes have CXCR4 and the macrophages have CCR5. This is known as co-receptor. This is known as co-receptor assembly, and co-receptor is responsible for fusion. This is how virus first attach, then fuse. I hope everyone got. I'm repeating. Kindly see. So as soon as the HIV virus come in contact with the host cell is human CD4 lymphocyte or macrophage. As soon as they are coming in contact, first attachment takes place, then fusion takes place. For attachment, the glycoprotein 120 of the virus bind with CD4 receptor of the host cell. For fusion, glycoprotein 41 of the virus bind with CXCR4 or CCR5 of the host cell. Okay, so here this is responsible for attachment and this one is responsible for fusion. So attachment is done, fusion is done. The two things are done. Attachment done, fusion done. Now next, the virus RNA along with the three enzymes. It is having three enzymes, I told you. It will enter inside the host cell. You can see. So this is the virus. This is the virus RNA. Okay, single-stranded RNA. It is single-stranded RNA of the virus which have entered the host cell along with the enzyme. The most important enzyme is reverse transcriptase. It also contains integrase. It also contains protease. So integrase, protease, and reverse transcriptase. With these enzymes, it is entering in the host cell. Okay, but what is the problem? The problem is that it is single-stranded RNA, but the humans have double-stranded DNA. The human cell, all human cells. So CD4 lymphocyte, macrophage, all human cell have double-stranded DNA. Double-stranded DNA. The problem is that RNA cannot integrate with DNA. Okay, RNA cannot integrate with DNA. So we have to convert this RNA into DNA. So who will do this conversion? So it's enzyme, reverse transcriptase. Okay, it have done its own arrangement. The virus is coming with its own arrangement. So virus is carrying its enzyme with it. Okay, so this is an enzyme. The name of the enzyme is reverse transcriptase. It converts single-stranded RNA to double-stranded complementary DNA. It will convert the single-stranded RNA of the virus to double-stranded DNA, the complementary DNA of the virus. Okay, you can see. So the single-stranded RNA got converted into double-stranded DNA. But I have given different color to the viral DNA. This is viral double-stranded DNA. Okay, I have given blue color. And this is host double-stranded DNA. I have given red color. You can appreciate it. Okay, so the viral single-stranded RNA got converted into double-stranded DNA. Now this double-stranded DNA of the virus, it will enter in the nucleus of the host cell. It will enter in the nucleus, and after entering in the nucleus, it will integrate with the host DNA. Now both can integrate. This is also double-stranded DNA. This is also double-stranded DNA. This is viral DNA. This is host DNA. They will integrate with each other with the help of second enzyme. The second enzyme is integrase. The first enzyme was reverse transcriptase. The reverse transcriptase was converting the single-stranded RNA of the virus into double-stranded complementary DNA of the virus, so that this double-stranded complementary DNA of the virus can enter in the nucleus of the host cell and can integrate. So second enzyme required here is integrate. Now you can see integration. You can see double-stranded DNA over here. In the double-stranded DNA, one strand is of virus and one strand is of host cell. You can see I have drawn two different colors. One is blue, one is red. You can see here, this one is blue, this one is red. They are integrating with each other. You can see I have shown you the integrated DNA. This is known as provirus. What it is known as? Provirus. The integrated DNA virus is known as provirus, and it remains latent for 3 to 10 years. For 3 to 10 years, it remains latent. It remains latent for if no treatment is taken. If treatment is taken, this latency can be prolonged. Okay, without treatment, variable from person to person, this will remain latent for 3 to 10 years. Nothing will happen. But after 3 to 10 years, okay, from this double-stranded DNA, mRNA will be formed. Okay, DNA, transcription and translation will take place. Okay, first, transcription and translation will take place. This is transcription. Transcription is formation of RNA on the leading strand as well as lagging strand. This mRNA will move out. This is transcription. It will move out. It will go on the ribosome. On the ribosome, this mRNA convert into protein. That is translation. Okay, so large proteins are formed. You can see, I have shown you the protein. This is protein. The large proteins are formed. And now we need the third and the last enzyme. The third and the last enzyme is protease that convert this large protein into small proteins. Okay, so protease, the name indicates it is cutting the protein into small. It is cleaving the protein into small particles. All these small proteins will form the capsid and nucleic acid of the new virus, daughter virus. So multiple daughter virions are formed out of these proteins. Okay, so the third enzyme is protease. The first was reverse transcriptase, the second was integrase, and third is protease. Okay, that is the mechanism of action of the drugs. I will teach you the drugs that inhibit reverse transcriptase. I will teach you the drugs that inhibit integrase, and I will teach you the drugs that inhibit protease. So this life cycle is ultra important. That's why I'm giving so much stress in understanding the life cycle. If you understand the life cycle, understanding the mechanism of action of drugs will be fun for you. Got it? Now the large proteins get cleaved into small proteins, and these small proteins leads to the formation of the daughter virions. In the daughter virions, the nucleic acid and the capsid is formed, multiple dot. And the last step, these daughter virions rupture, mind my words, they will rupture the host cell. It is known as lysis or rupture of the host cell. Okay, and they will come out. Okay, so the last step is rupture of human cell, host cell. So the human which is having HIV will be depleted of CD4 lymphocyte and macrophages. So immunity will drop, and that's why HIV is a immunodeficient disorder. Okay, secondary immunodeficient disorder. Okay, here the virus is depleting the immunity because CD4 lymphocyte and macrophages are our soldiers, they are our guards, they provide us defense. They are gone, they are lysis, they are lytic. Okay, and the viruses are coming out. These viruses will enter the next cell, the next CD4 lymphocyte and macrophage, and they keep on rupturing them. So the CD4 count gradually decline. Person will become immunocompromised, immunodeficient, and person have high susceptibility of infection, especially the opportunistic infection. That is the life cycle. I hope you got the role of the three enzymes over here. The most important three enzymes, the role of the three enzymes. So let me show you the life cycle in the form of a flowchart so that we can start the drugs quickly. I'm excited to start the drugs. So the first step, okay, HIV virus enters the host cell. Then it does attachment and fusion. Attachment is with the help of main receptor and fusion with the help of co-receptor. You know what are main receptor, what are co-receptor. So HIV virus is coming. Okay, and first it is attaching with the host cell. Okay, and then it is fusing. You can see this is attachment. You can see this is fusion. You know what is attachment, what is fusion. After attachment and after fusion, the viral single-stranded RNA move inside the host cell. You can see the single-stranded RNA of the virus is moving inside the host cell. Inside the host cell, okay, the reverse transcriptase enzyme present on the single-stranded RNA, it converts the single-stranded RNA into double-stranded DNA. So this single-stranded RNA converted to double-stranded DNA with the help of enzyme. The name of the enzyme is reverse transcriptase. Okay, now this viral DNA will move to the nucleus. It will move to the nucleus. You can see it is moving to the nucleus. After moving into the nucleus, it will integrate. You can see it will integrate with the host DNA. The host DNA and virus DNA integrate with each other with the help of enzyme integrase. Okay, the integrated DNA remain latent for many years, and after that, okay, this integrated DNA start forming transcription, that is mRNA. Okay, from the mRNA, protein is formed, that is translation. So first transcription takes place, okay, and then this protein will move out and translation takes place. So transcription, translation, okay, and then the big protein, the polyprotein, the big protein is cleaved into small pieces by the enzyme protease. And finally, the daughter virions are formed. They will rupture the host cell and they will come out. The daughter virions will come out. That is a complete life cycle. You can see the complete life cycle is shown in this flowchart, and in this flowchart only I will teach you the 6 categories of antivirus drug. You can see this complete flowchart. This is our master diagram for today. Please understand it. You can see this is HIV virus. You can see this is the cell membrane of the host cell, that is CD4 lymphocyte or macrophage. First it is coming, it is attaching, it is fusing. You know how attachment takes place, you know how fusion takes place. After that it is uncoating. After that, the viral single-stranded RNA convert into double-stranded DNA with the help of first enzyme, reverse transcriptase. Then this will move to the nucleus. In the nucleus, it will integrate with the host DNA. Okay, the viral DNA integrate with the host DNA with the help of second enzyme integrase. Now provirus is formed. The provirus remain latent for many years. After that, it will show transcription. mRNA will be formed. This mRNA move out and go on the ribosome and translation will happen. The proteins will form. The big proteins. The big proteins is cleaved with the third enzyme, that is protease, into small proteins. And small proteins form the daughter virions that will cause the rupture of the host cell and come out. So this is the complete life cycle. Now I will tell you 6 type of drugs you can see. They will inhibit the various steps in the life cycle. Okay, one by one I will discuss. Okay, so I will teach you 6 categories of the drugs. So let's start antiviral drugs. Okay, this was just a foundation so that you understand the chapter well. Nobody is going to ask you all this in pharmacology. That was a portion from microbiology. Now let's start antiretroviral drugs. So let's start pharmacology now. Okay. These are the drugs which are active against the patient who have the HIV. Okay, they are useful in prolonging the life and improving the quality of life. They postpone the complication. They postpone the Kaposi sarcoma. They do not cure the patient. There is no cure for HIV. They only postpone the complication and they improve the quality of life. They do not cure the disease. HIV once happened, treatment will be lifelong, and there is no cure for HIV. There is no cure. Because eradication of the virus is impossible, because virus is inside the human cell. If you want to kill this virus, you have to kill the human cell. So eradication is impossible. You can see eradication of the virus from the body of the victim appears impossible because the viral DNA already integrated with the human DNA. So eradication is impossible. We are not curing the disease. The aim of these drugs is not to cure the patient. The aim of these drugs is just to postpone the complication and improve the quality of life and increase the quantity of life. So that's the antiretroviral drugs classification. As I told you, there are 6 categories. They are in front of you. I guess everyone knows the classification. We will read it once. So there are 6 categories. I will teach you all 6 categories in a master chart under a fixed set of headings. You can see start. I mean, take out your notebooks, take out your pen. I always instruct you. Yes. So you can start filling this master chart with me. Okay. So you can see this is NRTI. You can see this is NNRTI. What is NRTI? What is NNRTI? This is nucleoside reverse transcriptase inhibitor. They inhibit reverse transcriptase enzyme. You know reverse transcriptase enzyme, and they are nucleoside in nature. That's why they are known as nucleoside reverse transcriptase inhibitors. They inhibit reverse transcriptase enzyme and they are nucleoside in nature. Chemically, they are nucleoside. They are non-nucleoside reverse transcriptase inhibitor. Okay, they also inhibit reverse transcriptase enzyme. They also inhibit reverse transcriptase. They also inhibit reverse transcriptase, but they are nucleoside in nature. They are not nucleoside in nature. They are something else. So this is known as NRTI. This is known as NNRTI. What is the full form of NRTI? And what is the full form of NNRTI? Okay, this is nucleoside reverse transcriptase inhibitor. This is non-nucleoside reverse transcriptase inhibitor. Okay, nucleoside reverse transcriptase inhibitor, non-nucleoside reverse transcriptase inhibitor. Both of them inhibit the same enzyme. The most important enzyme, the enzyme which converts single-stranded RNA of the virus into double-stranded DNA of the virus. The name of that enzyme is reverse transcriptase. They also inhibit reverse transcriptase. They also inhibit reverse transcriptase. They are reverse transcriptase inhibitors. But this one is nucleoside in nature. This is non-nucleoside in nature. So first 2 categories are very easy to understand. Drugs we will read one by one when we start them. This is NRTI. This is NNRTI. Call them. What is NRTI? Nucleotide reverse transcriptase inhibitor. What is NNRTI? This is non-nucleoside reverse transcriptase inhibitor. So nucleoside and non-nucleoside, both of them are reverse transcriptase inhibitor, the first 2 categories. The third category is protease inhibitor. It's protease inhibitor. The third category is protease inhibitor. Okay, the fourth category, you know, protease is the enzyme, we will inhibit it. Integrase inhibitor. Integrase is the next enzyme, we will inhibit it. The next is entry inhibitor and CCR5 receptor inhibitor. So what are the 6 categories? Can we revise them? NRTI, I mean the first 2 are reverse transcriptase inhibitor. I will inhibit reverse transcriptase enzyme. Then I will inhibit protease enzyme. Then I will inhibit integrase enzyme. You know, there are 3 enzymes I told you. This one is nucleoside reverse transcriptase inhibitor. This one is non-nucleoside reverse transcriptase inhibitor. This one is protease inhibitor. This one is integrase inhibitor. After that, entry inhibitor. And after that, CCR5 receptor inhibitor. So these are the 6 drugs. First you learn their names, inside which we will draw. First you learn the categories, then we will learn the name of the drugs inside them. Let's start one by one quickly. The 6 drugs quickly we will do. Let's start the first category, NRTI. What is the full form of NRTI? I told you it's nucleoside reverse transcriptase inhibitor. Okay, so they are effective against both HIV1 and HIV. 2. They are the most important drugs in the treatment of HIV, effective against both HIV 1 and 2. You know, there are two types of HIV, the two serotypes of HIV, HIV 1 and 2. How many drugs we have in this category? We are having many drugs in this category. The most important drug, the prototype drug in this category is Zidovudine. Zidovudine. You know, these are the names, the short forms given by the WHO based on their chemical structure. Okay, Zidovudine, it is written as AZT. Okay, the next is didenosine. The next is Stevidine, lamivudine, abacavir, okay, Tenofovir, and emtricitabine. You have to learn Zidovudine, didenosine, Stevidine, lamivudine, abacavir, Tenofovir, and emtricitabine. These are the name of the drugs in this category. I will teach you most of them. Most importantly, I will teach you Zidovudine. So first you learn the name of the drugs. Okay, first you learn the introduction, learn the drugs. Okay, in this table, first tell me the introduction. It is effective against HIV 1 and 2 both. Name of the drugs: Zidovudine, Stevidine, didenosine, lamivudine, okay, Tenofovir, abacavir. Please write down all drugs. The most important prototype is Zidovudine. Now, mechanism of action. The most importantly is mechanism of action. What is the next? Mechanism of action. So, NRTIs, that is nucleoside reverse transcriptase inhibitor, they enter the HIV infected cell. Can you see this cell? This cell is HIV infected cell. So suppose this is Zidovudine, okay, the prototype drug. The Zidovudine will enter inside the cell, and inside the cell it will convert into Zidovudine triphosphate. Okay, it will convert into triphosphate. If it is lamivudine, it will convert into lamivudine triphosphate. It is Stevidine, it will convert into Stevidine triphosphate. Whatever is the drug, it will convert into triphosphate form. Okay, because they are nucleoside. Now, you didn't ask me what is the difference between nucleoside and non-nucleoside. Both of them are inhibiting reverse transcriptase. But what is a nucleoside and what is a non-nucleoside? What is the difference between their chemical structure? These are inactive. After entering in the cell, they have to convert into triphosphate form to get activated, and they are directly active. They don't have to we don't have to do phosphorylation for their activation. So here we have to do phosphorylation. So Zidovudine, after entering the cell, it will convert into Zidovudine triphosphate, and the Zidovudine triphosphate will inhibit the reverse transcriptase. This will inhibit the reverse transcriptase. If the reverse transcriptase is inhibited, the viral single-stranded RNA cannot convert into double-stranded DNA. The double-stranded DNA will not form, it will not go inside, it will not integrate, and nothing will happen. So viral single-stranded RNA will remain viral single-stranded RNA only. It will not convert into double-stranded DNA because the reverse transcriptase enzyme is inhibited. Number one, this is the main mechanism. But this Zidovudine and all NRTIs, because they are nucleoside analog, okay, they are either adenosine, guanine, cytosine, or thymidine analog, one of them, okay, they will get incorporated into the viral RNA. Okay, when the viral RNA multiplies, they will get incorporated. So Zidovudine will get incorporated instead of the adenine, guanine, cytosine, and thymidine. Instead of the normal nucleoside, they get incorporated. So faulty RNA will form and termination of chain occurs. So that can also occur. But the main mechanism, they inhibit reverse transcriptase. I hope you got the mechanism. So what does NRTI do? NRTI, nucleoside reverse transcriptase inhibitor. They enter inside the HIV infected cell, convert into their triphosphate form. Their triphosphate form inhibit reverse transcriptase enzyme so that the single-stranded RNA of the virus cannot convert into double-stranded DNA of the virus. This will happen. This is main thing. This triphosphate form also get incorporated into the viral RNA and faulty RNA is formed. Okay, so that is a second mechanism. You can understand. Okay, so can you see the mechanism of action? You can see this is an NRTI. So NRTI triphosphate form. NRTI TP. TP mane triphosphate. TP mane triphosphate. So NRTI triphosphate form inhibit reverse transcriptase enzyme. They inhibit reverse transcriptase enzyme. That is the main mechanism. They get incorporated in the viral DNA and faulty RNA is formed. That is the second mechanism. But the main mechanism, they inhibit the reverse transcriptase enzyme. That's why they are known as NRTI. Okay, mechanism of action is done. So you know the introduction. Now, they are active against HIV 1 and HIV 2 both. You know the drugs. Zidovudine is the main drug. Lamivudine, Stevidine, didenosine, Tenofovir, okay, abacavir. These are the drugs. Okay, mechanism of action, they inhibit reverse transcriptase enzyme. Their triphosphate form inhibit this enzyme, not their normal form. Okay, now now onwards I will teach you the prototype drug. Okay, so let's continue with Zidovudine. So I am teaching you pharmacokinetics, uses, adverse effects, and interaction of Zidovudine. Okay, I'm continuing with the prototype drugs. For other drugs, I will teach you 1 to 2 lines. But main, you have to learn the prototype drugs in each category. So let's continue. Till here, it was common. Introduction was common for all of them. Drugs were common. I mean, I told you all the drugs. Mechanism of action was common for all of them. But from pharmacokinetics onwards, I am continuing with Zidovudine. So let's start Zidovudine. Zidovudine is a prototype drug. It's a thymidine analog. I told you, some of them are analog of adenosine, some of them are analog of guanosine, cytidine and thymidine. So they are nucleosides, 4 nucleosides. So Zidovudine is a thymidine analog. You have to learn it. Okay. It is the first antiretroviral drug which was discovered, which was approved for the treatment of HIV. You get question. It was a pioneer drug, most important drug. It is effective against HIV 1 and 2 both. It protects the cells which are uninfected from HIV. The cells which are already infected with HIV, it cannot be treated with Zidovudine. Okay, because integration, once the integration already happened, we cannot treat it with Zidovudine. Zidovudine inhibits reverse transcriptase. Okay, so once the reverse transcriptase is inhibited, the single-stranded RNA cannot convert into double-stranded. But the cells which are already infected, in which integration have already happened, we cannot treat them with Zidovudine. Pharmacokinetics, it is given orally. It is well absorbed orally. It is metabolized by glucuronide conjugation. You know, phase 1 conjugation, phase 2. In phase 2 conjugation, glucuronide conjugation is most important. It is excreted unchanged in urine. It can cross BBB. It is secreted in breast milk also. So you have to learn. These are factuals. You have to learn the pharmacokinetics. Uses. It is not the main treatment. In the end, I will tell you the combination, the first line regimen, the second line regimen of HIV. Let me teach you these 6 categories. After that, I will tell you what is first line regimen, what is second line alternative regimen. It is used in alternative regimen, not the preferred regimen. So Zidovudine is used in alternative regimen. There also we will revise when I will tell you the regimen. It is not a preferred regimen. It is alternative regimen of the first line. In the first line, we have 2 type of regimen. Okay, preferred regimen and alternative regimen. It is first line, it is not second line, it is first line. But in the first line, it is alternative regimen. Okay, it is always given in combination with other drugs. That is the uses. Okay, in HIV, of course, use of all of them is HIV. Adverse effect. Okay, adverse effect. The most important adverse effect of Zidovudine is hematological. It causes bone marrow suppression. Because of bone marrow suppression, there is anemia and neutropenia. There is anemia and neutropenia. The second is GIT. There is nausea, vomiting, abdominal discomfort. The third is CNS, headache and insomnia. Okay, the fourth is liver. It causes hepatotoxicity. And third is musculoskeletal. It causes myopathy and lactic acidosis. So say the 5 adverse effects of Zidovudine. Okay, with the help of images you can retain. And with the help of systems you can retain. Name the 5 adverse effects. Bone marrow toxicity, bone marrow suppression that leads to neutropenia, anemia, pancytopenia, GIT, nausea, vomiting, adverse abdominal discomfort. CNS may headache, insomnia. Okay, hepatotoxicity, myopathy, lactic acidosis. So please learn the side effects, adverse effects of Zidovudine like this. Okay, Zidovudine. Drug interaction. The last is drug interaction. Don't give Zidovudine with 3 drugs. Okay, never give Zidovudine with paracetamol. Never give Zidovudine with azoles. And never give Zidovudine with Stavudine. Okay, you should know the reason why we shouldn't give Zidovudine with these 3 drugs. So one by one we will discuss. The first one, never give Zidovudine with the paracetamol because Zidovudine and paracetamol both are metabolized in the liver by glucuronide conjugation. If you are giving Zidovudine and paracetamol together, they both get absorbed, go inside. They both of them will go in the blood. From the blood, both of them go in the liver, and they both, Zidovudine and paracetamol, compete for glucuronide conjugation. They both of them, they will compete for glucuronide conjugation, and paracetamol interferes with the glucuronide conjugation of Zidovudine. Okay, it will inhibit, paracetamol will inhibit the conjugation of Zidovudine. So Zidovudine will remain in the blood only. It will not get metabolized and its toxicity can happen. It will lead to Zidovudine toxicity because paracetamol is inhibiting the conjugation of Zidovudine. So Zidovudine toxicity, bone marrow suppression can happen because its blood concentration will increase because it cannot go in the liver, get metabolized. Okay, I hope you can get it. The second is Zidovudine, never give it with azoles. Don't give Zidovudine with azoles. No. Why? Because azoles, you know what are azoles? I taught you, they are antifungal drugs. Azoles are antifungal drugs. They are enzyme inhibitors, CYP3A4 enzyme inhibitors. So if you are giving Zidovudine and azoles together, both will go inside. They will get absorbed. They will reach in the blood. From the blood, they will go in the liver. Both of them are going in the liver. Suppose this is Zidovudine and this is azole. Okay, azole. Azole enter inside the liver. Both enter inside the liver, but azole inhibit the enzyme. See the negative sign. It inhibits CYP3A4. It inhibits CYP3. So CYP3A4 will not function. Normally CYP3A4 causes the metabolism of zidovudine. Now since it is inhibited by azole, so metabolism of zidovudine will not occur. So zidovudine will remain in the blood and it will cause its toxicity. So again zidovudine toxicity will happen. You should be able to explain it. So azoles are antifungal drug. They inhibit the cytochrome 3A4, okay, cytochrome P450 enzyme, okay, and it will inhibit the metabolism of zidovudine. So zidovudine plasma concentration will rise and that will lead to zidovudine toxicity. So here also zidovudine toxicity, here also zidovudine toxicity, and the last, don't give zidovudine with stavudine because both of them compete for phosphorylation. I told you now how does they act. After entering inside the cell, they convert into triphosphate form. If you give them together, both of them want to convert into triphosphate form. So they compete for phosphorylation. So they will inhibit each other phosphorylation. I mean, they will compete and they will interfere. That's why don't give them together. Okay. So that is the interaction. We are done with the first category. Can we move on the second one? Can we move on the next category? Huh? So we are done with the prototype drug of the first category. Okay. Let me revise it. So introduction may NRTI. I told you they are active against HIV-1 and HIV-2 both. Drugs may zidovudine, stavudine, lamivudine, diadenosine, and tenofovir, abacavir, many drugs I told you. Mechanism of action, they inhibit reverse transcriptase enzyme. Actually, they don't inhibit. Their triphosphate form inhibit reverse transcriptase enzyme. That must be wiseful to say. Pharmacokinetics of zidovudine, you learn yourself. Uses, it is used as first line regimen, but as an alternative regimen, not the preferred regimen. I will tell you the regimens. Adverse effect, you learn it, but most important is bone marrow toxicity, hepatotoxicity, okay, GIT, CNS, okay, and myopathy. Interaction may don't give zidovudine with 3 drugs. Don't give it with paracetamol, with the azoles, and with stavudine. You must be knowing the reason. Now I taught you zidovudine, but for others I will tell you one line. You have to learn that important line. So we are done with zidovudine, but for others I will tell you only important points you have to learn. So the next is diadenosine. Okay, mechanism of action is same. The mechanism of action is same as that of zidovudine. It's a purine analog. It's also thymidine analog. It's also purine analog. Okay, but in contrast, what is the difference? In contrast to zidovudine, it don't cause myopathy. It don't cause bone marrow suppression. It don't suppress bone marrow. The most common side effect there was bone marrow suppression in zidovudine. But in diadenosine, the most common side effect is neuropathy, stalk and glove. You know what is stalk and glove? So patient have neuropathy on the palms, front and back, and patient have neuropathy on the legs and the foot. So this is gloves and stalk pattern. Gloves and stalk pattern neuropathy. I guess you know that. Most important side effect of diadenosine is diadenosine is this neuropathy. It is not bone marrow suppression. That's what you have to learn. Next is stavudine. Stavudine is also a thymidine analog. The mechanism of action is same. Okay, this is also thymidine analog. This is also thymidine analog. The mechanism of action of diadenosine and stavudine is same as that of zidovudine. Okay, but here the side effects is different. Here the main side effect is neuropathy, glove and stalk pattern, stalk and glove pattern neuropathy. Here the most important side effect is lipodystrophy. Okay, lipodystrophy, lactic acidosis, and peripheral neuropathy. Peripheral neuropathy, it is not necessary stalk and glove pattern, but it is simple peripheral neuropathy. Stavudine is no longer used in the WHO regimen, except in certain exceptional circumstances. We don't use it because of these severe side effects, especially because of lactic acidosis. We don't use it. Stavudine. The next is lamivudine. Lamivudine is a cytidine analog. This one is thymidine analog. This is also thymidine, and zidovudine is also thymidine. But this one, lamivudine, is a cytidine analog. I taught you this drug in hepatitis B virus treatment also. If you have watched my session, okay, non-retroviral drugs may. I taught you hepatitis B treatment. There also I taught you lamivudine. So lamivudine effective in HIV as well as chronic hepatitis B treatment. Okay, in HIV, it is the first line treatment. I tell you, it is a preferred first line treatment. But in chronic hepatitis B, it is no longer a first line treatment. It is used in exceptional circumstances because of development of resistance. Okay, the side effect is pancreatitis and peripheral neuropathy. Pancreatitis and peripheral neuropathy. These are the facts you have to learn. The next is abacavir. Abacavir is a guinosine analog. This one was a cytidine analog. You know, there are 4 nucleosides: adenine, guanine, cytidine, and thymidine. Okay, so zidovudine, lamivudine, zidovudine, stavudine, and diadenosine, they are thymidine analog. Lamivudine is a deoxycytidine analog, and the next abacavir is a guanine analog. So you have to learn which one is an analog of which nucleoside. It's a guinosine analog. Okay, the mechanism of action is same. Its triphosphate form get incorporated in the viral DNA and terminates the elongation. It is used in the first line regimen in children, not in adults. And most important side effect is hypersensitivity, severe hypersensitivity. Okay, because of massive release of TNF alpha. Okay, these all are your MCQs. The last here is tenofovir. The last here is tenofovir. Okay, all of them were nucleoside analog. Tenofovir is the only anti-HIV drug which is a nucleotide analog. It is not nucleoside. It is not nucleoside analog. It is nucleotide. Mind it, this is not nucleoside. It is nucleotide analog. Okay, it is the only anti-HIV drug which is a nucleotide analog. It is effective against hepatitis B also along with HIV. It is used in first line treatment. It is the least toxic among all drugs. That is why it is used in first line. And most important toxicity is renal toxicity. So we are done with NRTIs. I taught you all of them. Okay, you know everything about them. Let's move on the second category. The second category here is NNRTI. Let's move on the second category quickly. The second category here is NNRTI, non-nucleotide reverse transcriptase inhibitors. NNRTI. Okay, so what is the full form of NNRTI? Non-nucleotide reverse transcriptase inhibitor. Okay, what is the difference? They do not require phosphorylation after entering the host cell, HIV infected cell. They can inhibit the reverse transcriptase enzyme directly without phosphorylation. That is the difference. They are highly effective against HIV-1 but not effective against HIV-2. Okay, these were effective against HIV-1 and 2 both. These are effective against 1 but not effective against 2. Okay, here phosphorylation is required. Okay, here phosphorylation is required.
Hello everyone. I hope you found this concept clear and easy to understand. If you would like to dive deeper into this topic and master it with full-length lectures, you can subscribe my app, that is MedLife by Dr. Priyanka. So, join me for the live sessions where we break down the complex topics in a way that makes them simple and high yield for exams. See you inside.